Hi. Hey. Okay. We're going to talk about COVID-19, which is not a worry, pretty much. It's the same likelihood I just discovered. I researched it. It is the same likelihood of dying from the flu as dying from COVID-19. So we can all pretty much be sure that it's not going to be that bad of a thing. It's just another type of virus very similar to the flu. If people are in very good health, they have cold-like symptoms. Cold-like symptoms. Like I just ate some food really fast, but 3.4% of people infected with COVID-19 die, and it's generally people in poor health or people older than the age of 80. So if you're in somewhat normal health, you're probably going to live. If you're in very good health, you may only have cold-like symptoms from it. So it's the same, nearly, it's obviously a different virus as getting the flu. People, 3.4% of the people who get it die from it. So that's very low, and generally it's people older than the age of 80. How many people, how many cases or people got COVID-19? None? Oh, they have, I thought they'd have zero. They have 60 cases. 60 cases. They may have no one who died from it. I don't know. In India. That's in India. Ireland. The whole world. How many cases of corona? It's less cases than the flu, that's for sure. Corona. And you're okay. How many cases of coronavirus on Earth? Globally. Uh, oh, that was not in China. Actually, the entire, well, all of the cases reported so far are like 130,000, 120, 29,000, 120, whatever it is, because a lot of them are getting better from it. And I don't know how many currently have it, but that's how many cases have been reported so far. They say 200,000 of the flu. The flu have reported 200,000. There it is. The coronavirus. 129,000 cases and 47. Oh, I thought that was just in China. That's actually the live statistics and coronavirus news tracking the number of confirmed cases, recovered patients, and death toll by country. This is worldometers.info. Coronavirus cases 129,347. Deaths 4,749. Recovered. Hey, it has recovered. 68,000. Well, most are going to recover. It's like the flu. It's less harmful to a human being in general than the flu. So they're still trying to close areas to like make it not spread and stuff. And I don't know what else to say. Um, that covers most of it. I don't want to joke about it and have the airplane movie or something and showing somebody on a plane joking, because it's a serious thing, but it's not like it's not like those things that killed okay, here's the odds: 129,000 people and 4,700 deaths. That is a little more than That is like 3.4% is what they said, I think. I don't know exactly the odds on that, but that looks like about 3.4%. Multiply this by like 30, multiply this number by 30. That's about it. It's like 3.4% likelihood of dying if someone gets it, and it's generally from people who are in old age, older than 80, and people in poor health. Some people can be in better health for their age, but I'm not going to comment on that because they say it's people who are older than age 80 and poor health. But it's, there's not that many people. A lot of them, it's like getting the flu. So it's like China has the most. China has the most. 80,000. Here's the coronavirus, 129,000 cases, 4,000 deaths. Here's view by country. China, 80,000 something deaths. Italy, 12,000. Iran, 10,000. South Korea, Spain, France, Germany, USA, Switzerland, Norway. Wow. What is Diamond Princess? That is very odd. Oh, what is? I don't know what that is. That other than is that Diamond Princess? Oh, I don't. I think that's a cruise ship. Oh, that was that cruise ship. That was that cruise ship that I don't know. I don't know what this is. That's something else. Okay. Um, Japan, Denmark, Netherlands, Sweden, UK, Belgium, all these Australia, Austria, Austria. I wonder if Australia's on there. China has 3,000 deaths, by far the most. 3,169 deaths. Um, and we can compare this to the deaths from the flu, which are 8,200 to 20,000 deaths a year from the flu. So coronavirus is 3,000 right now. Okay, it's it's a less likelihood of dying from the coronavirus than dying from the flu if you actually were to get it. 3.4% die from coronavirus, they say, about, and 4.4% to higher percent die from the flu, they say. But I guess that's including older people and people who are not in the best health. They say maybe it's about 4%. I don't know exactly, but that's what they said before. I showed the statistic on that from before. So you're probably not going to die. That's like a 90 something percent likelihood you'll be okay if you got the flu, and 90% something likelihood if you'll be okay if you got COVID-19, which you're probably not going to get as much because they're trying to contain it. They're trying to contain it, but it's like another flu, sort of. But I don't know. how the virus relates to the flu exactly. How is COVID-19 like the flu? COVID-19 versus seasonal flu. What you need to know. This is from 22 hours ago. This is from 22 hours ago. This is from the Mayo Clinic. They're a very innovative place who does good for people. Um, Seasonal flu. Oh, right now, seasonal flu is causing many more deaths than COVID-19, they said. Thank goodness. And the tragedy is that many people die because they consider it just the flu. I don't know what that says, Dr. Poland. Dr. Poland. Numbers are constantly changing, but as of now, the Centers for Disease Control and Prevention estimates that more than all these people have been sickened by the flu. Oh, they estimate more have been hospital. Oh, more and more deaths. But that's just the flu. It's not that bad of a thing to worry about. But we should be really healthy so we don't die of the flu. Because if somebody gets more stressed out or like way overweight or something from eating carbs and added sugar, that's how you add body fat. It's from carbs, heavy carbs and added sugar. Add um you can't add too much body fat when you're eating protein, fruits and vegetables, and fats. You can eat the fats. You can eat butter and um, uh, olive oil, guacamole, other sources of fat, and it's okay. But you have to watch the cholesterol because then it could hurt your heart. So you just eat less of the saturated fats. Like you can have butter; it's not gonna hurt that much, but like not tons of the heavy meats like steak and butter and stuff like that. If that's your main source of protein, but it's gonna be leaner if you're not having those carbs. So you want to try to get physical activity too. And then eventually we're all going to get old and die of something, so it's not going to be that much of a concern anyway. We're all going to die of something. Um, okay, so this is the flu. Right now, this is the best thing. This is the thing that I think is the best. What it says about it. Right now, um, seasonal flu is causing many more deaths than COVID 19. Right now, see, the seasonal flu, the flu, is causing many more deaths than COVID 19. And the tragedy is that many people die because they consider it just a flu. They added that at the end because it's serious. That's what Dr. Poland said of the Mayo Clinic. Um, right now, seasonal flu is causing many more deaths than COVID-19, and this is the statistics on it. The number, the numbers are constantly changing, but as of now, 350,000 to 620,000 people have been hospitalized for the flu. This is the flu. This is the flu. This is the seasonal flu. The seasonal flu right here, seasonal flu. And They say it's causing many more deaths than COVID-19, and the likelihood of dying from that um, is a little more likely than the likelihood of dying from the flu in general, if anyone gets it, is higher chance of dying from there's a higher chance of dying from the flu than dying from COVID-19. If you do the numbers on it, 20,000 to 52,000 people who die from the flu out of 350,000 to 620,000 people who have been hospitalized, the reported cases. Generally speaking, I don't know. I mean, I guess people are gonna have to go to the hospital and deal with other things, but I mean, there's all sorts of things that can happen to people, but this is a serious concern because right after this, they said the tragedy is that many people die because they consider it just the flu. So it's just as dangerous as the flu, but the flu is very dangerous, more dangerous than we thought. I guess I'm guessing because I had the flu one time and I was like really worried, and I lost. After that, I got in very good shape, because I didn't want to like die from it. I was already having some. You don't want to be having health concerns too much and then get the flu. So, you probably live through it because there's a good chance you'll live, like 90 something percent chance in general. But if you're sicker or something's funny about you in some other way, then there's a greater likelihood of dying from the flu or COVID-19. But it's about the same, I believe, COVID-19 as the flu. But I'm not sure how the virus is genetically similar to the flu. I want to see how. I'd like to see. Maybe that's too much. Needs a scientist or doctor or something to explain that. Um, I don't think we need to know that much, like how similar. I wonder what the symptoms of COVID-19, symptoms of coronavirus disease. Patients with COVID-19 have experienced mild to severe respiratory illness. Ugh. Patients with COVID-19 have experienced mild to severe respiratory illness. Symptoms can include fever. Symptoms may appear 2 to 14 days after exposure. Cough. A cough could be from a lot of things, but that shortness of breath. Those are some of the symptoms. Those are common from a variety of things. Not just this disease, but those are the symptoms that it shows. Common cold. It's not the common cold, but some people who are in very good health report that they have similar symptoms to the common cold. Is the flu a cold or COVID-19? All right, that's what it is. It's kind of like the flu. It's more dangerous than the cold. Different viruses present similar symptoms. Is it the flu, the cold, or coronavirus? COVID. Okay. First 4 months of the outbreak, coronavirus has killed about 4,300 people. Actually, now it's up to 47 or 800. Flu kills 290,000 to 650,000 every year around the world. That's the flu. That kills 290,000 to 650,000 every year around the world. That is the flu. That is terrible. Like that's here, and we probably can't get rid of it unless somebody gets a vaccine for it. I think there are various strains of the flu. Um, they have, they have a vaccine for it, but it's not quite. You get one, and then it's good for the rest of your life or something, or like the some of those vaccines or shots that they can get prevent it forever. But the flu is kind of evolving, and we keep a it doesn't it's had the same effect on everyone every year. It changes a little bit, but it's about the same. It's about the same, and then that's been the same probably for maybe thousands of years, hundreds of years, maybe thousands, maybe since the beginning of time. The flu. I'm not sure exactly, but modern medicine is constantly evolving too to help us keep us healthier. So um, it's generally the life expectancy goes up as time goes by in the first world, really, and probably a little in the third world, um, because of modern science, medicine, stuff like that. It's not too crazy. It doesn't make us live to be like hundreds of years old or something. That would be horrific. I wouldn't want to. We're supposed to die at a certain time, and hopefully we'll learn the lessons we're supposed to on Earth, and be kind people and go to the other side. But that's another thing. That's like more of a spiritual or religious belief, and that's up to the individual to do that. But I believe in being kind to others. I think that's what it's all about, not about like more worldly things. You can take precautionary measures to um, make sure you're healthier, and and make sure you're away from um, risks that could hurt your health, like getting the coronavirus or getting the flu. I guess by traveling less nowadays, but the numbers are not a lot. Mostly it's in China. I mean, it's kind of a lot. It's a lot, but I mean, if you do the odds in America in 4 months, it's about it's less than the flu right now. It's a lot less than cases of the flu right now, but it still could be dangerous. It still could be dangerous. So you want to like kind of travel less and stuff unless you're very healthy and you're not worried about getting it. But you have a greater chance right now, I think, of getting struck by lightning. Much greater chance. So I was learning about it as this video went by. I don't have all the answers, and I'm going to make a disclaimer that I'm not a medical professional. I'm not a professional at uh, science and health, and someone who's an expert at diseases and things like that. But I'm just doing this as like a lay person commenting, who who's a filmmaker, actually a filmmaker. I have degrees in film and stuff like that. I did film, and or that's what I worked at and I'm good at, and I'm just commenting on it from what I know in film and other stuff that I do, and as a person who's just you know not a doctor. So you might have to ask a doctor or something if you want to learn more about it, but you can do your own research and follow the news and stuff and take precautions necessary. And okay, that's it. It could be potentially dangerous, and you want to make sure to um, use your own level of safety with it. You can wear masks out in public. You can not wear masks out in public because hardly anyone's probably gonna, you know, it's less. It's right now there are 129,000 cases of it, or 130,000 that have been reported, and every year there are hundreds of thousands of cases of the flu, and the flu is more deadly than this. So we'll see how it goes, but um, they're trying to stop the spread of it. They're trying to quarantine areas and let it go away with people so that it just goes away forever. That'd be amazing. That'd be amazing. So if people are like not traveling as much, I don't know if that has anything to do with it, but if you have to travel, you have to travel. In the U.S., there's been 1,000 cases reported out of 300 million people. You can do the math in your own way. I'm not a healthcare professional. I'm just saying what it's like for my way of looking at things. Gosh, so many people have watched this. Okay, I'm going to change the title of this. A regular guy's perspective. Or something like that. Whatever I'm going to call this thing. Okay. I'm going to go. Man, somebody's got to use your own judgment on how to be out there. It's something a little not as strong as the flu. It's not as strong as the flu. And I tell you, we have got to go. Be careful out there. That virus might fly through there, and it's it's generally with close physical contact is how it's contracted within 6 feet of close contact. That's how it's contracted the coronavirus, the COVID-19. The technical name for it, that's what the thing is. Okay. I'm gonna go. Be careful out there with the COVID-19. Hopefully, it all goes away. And worst case scenario, it's not some thing that everyone dies from. Actually, only 3.4% of people die from it, they say. So it's not super bad. It's unless it was like a movie super bad, which is something else. I don't want to comment on that or something. Um, Super bad something or another. Um, um, anyway, I'm gonna try to go. I might try to go travel. I might try to go travel and see my kids, but I'm not gonna show up at their house right off the plane. I'm gonna stay somewhere like at a hotel, maybe for up to a week, like 4 or 5 days, 4 days or something like that. So I'm sure I don't have it. I'm going to do the research and make sure I don't give them the COVID-19, or I don't get it, or if I get it, I want to be okay. And I'm going to make sure I'm healthy as I can before I fly. And these are the precautions that I'm taking. Um, uh, oh, that was a Fox 2 News. Um, I don't want to be biased one way or another. This is right wing. I was reading something on the right wing stuff. Um, Even in the right wing stuff, and Trump is not traveling as much. That's a good idea, I guess. he's the president, so I kind of have to go along with what he's saying for me personally. But people can use, as long as people are still flying out there, they might try to close down the airports, but that could cause more deaths and stuff from people who have to go to hospitals or do things to make sure they don't die. So it's like they're gonna have to weigh that and figure out um, which airports they're probably going to keep the airports going in the U.S. I don't think it's that much of a risk, but they're going to close off some of the international travel to China, I would assume. I think there's a lot of people in China with it. Most of the people who have the COVID-19 coronavirus thing are in China by far. There's way more there than the next unpopular, I guess, place. Okay, um, um, for the coronavirus, we hope. Because if it's unpopular for the coronavirus, that's good. Okay, I'm gonna go. Um, Generally speaking, but I ain't trying to you know comment too much one another because I'm just a regular person. I'm a an average person who is not. Uh, I don't have a degree in medicine. Um, but I'm an average person, and this is my perspective on it. I do the research. I'm educating stuff, so I know how to like read more. If you're self-educated, you can do your own reading, or I could, I've learned a lot by just going out there and doing and reading more. And um, this is what I think of it. This is what the facts say on these websites that I showed you. It's like the flu. It's a lot like the flu. It's a lot like the flu. Probably they say maybe there are. Oh, this is an exaggerate. This is Fox News. This says only 0.1% of those with the flu um, get killed. The flu kills 0.1% of them. There's another site that I showed you. This says coronavirus, they estimate 1% to as high as 4%. The other deaths said that they were 3.4% from coronavirus. This Fox News thing says 1% to 4%. This Fox News one is saying that the flu kills about 0.1% of those it infects. However, look, it says on the same. It says on the same. Oh, it might be a different site. Yeah, the flu kills 290,000 to 650. And that's COVID-19. Ugh. No, it says the flu. It literally says right here, flu. Flu kills 290,000 to 650,000 every year around the world, according to the World Health Organization. To some, the comparison seems comforting because flu is such a familiar foe. President Donald Trump regularly brings it up, noting in a tweet how many more Americans die from the flu and adding, nothing has shut down life and the economy go on. Think about that. That's what he said. From the flu. Apparently. Yeah, from the flu, he said. Nothing's shut down, life goes on, economy. Think about that. Compared to the coronavirus, COVID-19. When I looked up how many die percentage of people who die from the flu. Seasonal flu, it says less than 1%. So it says one person, this is the same person the other person must have, the Fox News must have quoted, said it's at 0.1%. was something else that I had found on here that said it was 4% because uh, I'd like to keep, obviously everyone would like to keep the numbers down in the flu. How many people, that would be great, but the coronavirus is out there. It could be dangerous, really dangerous, more than the flu. So maybe I'll have to research it more because I'm just a regular person. I'm not a doctor. You're going to have to ask a doctor about this if you want to really learn about it. If you don't trust your own um, research ability to know how safe or unsafe it is. How many people die from the flu? 56,000 people die from the flu or flu-like illness every year. That's another one. These are all varying but close. They're in the same. So far, 14,000 people have died and 250,000 people have been hospitalized during the 2019 to 2020 flu season. I'm assuming that the 250,000 people who were hospitalized for the flu, I'm assuming that those 250,000 are reported are all the reported cases of the flu, and 14,000 of those have died. So that's a pretty high percentage. That would appear that it's higher than 3.4%, that it's like more like a little higher than the COVID, but I don't know if that's correct or not. You'd have to really, really research and almost come up with your own statistics to really find the answers, because none of these are definitive studies in and of themselves. And we generally have to think confidently about it that, we're not going to get it. It's okay. Everything's okay out there. There's nothing to worry about as much, and then take the precautions necessary, be informed and be aware of how stuff like that spreads. It's within 6 feet of contact how the COVID-19 spreads. Some people are wearing masks and stuff, but I don't know if that's necessary or if that's up to your own, I know that's up to your own judgment or not, but I'm not going to wear masks. Here's a person wearing a mask. Here's one. It's complicated, Dr. Drew said. He said you're more likely to die of influenza right now than the 2019 coronavirus. Hey. Use your own judgment and be informed. Try to get a doctor's opinion if you're really, or just be informed. That's all we can really do, unless there's an expert who happens to be a doctor, medical doctor you trust more. But I'm just a regular, average person who is qualified in other things, but I have an education at a lot of higher education institutions, universities, and stuff like that. I've been in 9 colleges and universities. Virginia Tech. I was enrolled at Virginia Tech. I have an excellent engineering school and all sorts of other things. I was enrolled at Virginia Tech, Radford University. I started at a community college, Virginia Western Community College. I went to I've gone to all sorts of schools, and I got my degree from LMU in communications, and kind of another major in screenwriting. And I did movies. I produced two award-winning films there, and one of them had Shia LaBeouf on stage. It was a real red carpet award ceremony in Los Angeles, the Young Artist Awards, the one for children. It's like the Oscars for children, but a little different. And we worked on that from when I was like 20, I started working really hard at movies till I was like 23, and I had already done it my whole childhood. I was making videos in 1990 before that, when I was like a kid, like 12 years old, or 10 years old before that in 1987. And so that's what I do, is movies. And then I got degrees. I went to all these schools for the degrees. So that's how I'm qualified, is that I know how to study, make good grades in school. Um, I made like straight A's and some B's at most all my colleges I went to and universities I went to. And in screenwriting school, I I I got all A's. I was on the dean's list. The dean's list. Pretty sure it was the dean's list, or it was all A's in my screenwriting classes, and like a couple B's in some of the other classes that had to do with stuff that I wasn't as interested in. And then I went to, I have award-winning films. I did films and video. I went to another school. That was a Jesuit school. That's where I met my wife. Then we got married and had kids. And before that, I did some. I have an MFA. I have an MFA at one of the best film schools there is. It was really hard to even get through that, because it was like I was trying to save money and do it too and stuff. And anyway, that's how I'm qualified. Is like I went to a lot of colleges and universities, about 9 of them, and ended up getting an MFA and a BA from some good film schools. And I know how to study hard to have gotten into those schools. It was a lot of effort. So that's my perspective where I'm coming from. I'm not a medical doctor. I'm like a little more than a lay person for this type of thing. Um, but you may want to ask other professionals or do your own research, and it's probably okay. Um, how many people die from the flu? 56,000 people a year. Wow. That's something to kind of look out for, being good health and stuff. People can die from the flu more often than we may have thought. It says 14,000 people have died and 250,000 people have been hospitalized during this flu season. The most current flu season, 2019 to 2020. So to do the math on that, 14,000 people out of 250,000 people hospitalized. That's a pretty high percentage. So you want to stay healthy, eat less carbs and less added sugar, get more physical activity, move physically, don't move your house, don't do anything crazy or worrisome too much where it's giving you too much stress. If you have anxiety or something and you're otherwise physically healthy, I guess that's okay. That's not going to hurt your um, odds as much of dying from those things. It shouldn't. Anxiety, unless that's stress related, and then the stress could cause you to be more physically hurt and sick if you're working way long hours or something like that. You're worried about stuff too much, and stress can hurt people, can give them all sorts of problems. But generally, it's just going to give you don't worry. That it can make you worry more and more. Like some people worry too much, and then generally it can give you pains in your body, and then it goes away when you get calm. But pains that you might think are something serious or you could die from, like it could be like right where you have a heart, like right where your heart is, or something, or you might think you're going to get cancer or die, or all sorts of things from stress. So some people, trying to be stressed, trying to work too hard. Some people get a stroke. That's a common one from too much stress. And when people are less physically active and less physically fit, then they're more prone to getting hurt from the flu or COVID-19. COVID-19. So it's generally something you don't want to worry about too much because 90 uh 90 something percent or 97% are okay. They make it through having the COVID-19 and they don't die. So generally people are going to make it through it. Um, um, unless they're older than, unless they may be at more, they are generally, in fact, at more risk if they're older than the age of 80, or they have existing health issues and health concerns that may be something that interacts with the symptoms of the COVID-19 virus, the virus, the virus, or the flu. But you don't want to, you know, this is as best as I can, um, um, you know, explain it. And okay, thank God. Okay, for the people who are on my channel, who have been on my channel a while, this is a new type of video. I got live video making software. I got live video making software. I just learned some of it. It was free. It was free, but it's the best one that they make. And I think I can do cool things like the way I edit and stuff. Or I can cover various topics. This is a more serious one. I can go into more fun, happier ones. I can show a video game and comment on playing a video game with my kids. They've wanted to do those video game commentary ones. There's all sorts of videos that I can do with this new. This is just shows a window in the back. This just shows the browser in the background and me in the side. Whoops. Me in the side. I'm trying to click on it and move it, but it's not. Oh, here it is. Here's me. I don't want to joke about it too much in this video because, I haven't taken a shower yet this morning. I should probably take a shower. Wow. I slept on my hair. I don't know what I look like. Okay, my hair's finally growing in. I really shaved it close to the skin on the top, and um, I had to dye it. I cut it short, and anyway, that's me. Okay, I'm gonna make this smaller. COVID-19. No, no, no. I'm a little man. I'm a little man. I'm gonna go fly to China. Oh no! Be careful. Careful if you're going to China. Now I might go to Italy. Italy, I'm okay. Maybe you got to really work out and be healthy, and eat right, and get ready to fly if you have to fly. You want to make sure you don't want to get the sickness, and maybe wear a mask or something if you're into that, if you can. But be careful. Don't fly as much unless you really have people to see, or make sure everything's okay with other people, and don't spread the virus. Don't contaminate other people. Stay, kind of away from people more, unless nobody in your town has it. That'd be amazing. Or very few people have it. Like in America, 1,000 people or a little more than 1,000 people out of 300 million people have it. That's not a huge amount. It's generally from overseas travel from China. Apparently, see these statistics. 80,796 people have it in China, and I think they quit the travel to China. I think they've quarantined China. I'm not sure exactly. We can see they may have quarantined some of the areas. Quarantine. You wouldn't have to work at your job if they made you be quarantined. I guess you'd get. That would be terrible. What if you had to make enough money? Quarantine. A state, period, or place of isolation in which people or animals that have arrived from elsewhere or been exposed to infectious or contagious diseases or place. Probably someone might try to say that about me. Were you quarantined because you're away from everyone? No. Quarantine you because you have a disease. That is horrible. That is really horrible. I don't joke about diseases. They're pretty terrible. A disease is a horrible thing. A disease is a particularly. Let me see this. Whoops. I'm getting my face over to this, away from this thing. This is something you don't want to joke about, that people can actually die from as you're joking about it, and then you'd feel horrible. Horrible. And if you didn't know that some of them would die, you're just joking about a disease and stuff. It's terrible. Anyone can get diseases, and everyone probably will get a disease that makes them feel bad. So it's like you don't want to joke about it too much. We're not necessarily going to die from it. You're likely actually to die from heart disease and cancer. Those are the two number one leading causes of death that kill most people. COVID-19 is a lot less, like hardly any deaths from it comparatively so far. 3.4% of the people infected and not as many infected. So it's like one in a billion, or 1 in 100 million, or 1 in a mil. The highest risk of getting it and dying would be like 1 in. You'd have to do the odds, but anyway, a disease is a particular. You want to be careful, not to get a disease, but you have to go out there and live too. Life goes on with the world. The economy keeps doing things, as what's his name said, and besides the economy, that's not the important thing. If you have plenty of money and everything's okay, you don't want to be joking about people who have diseases so that you can have even more money when you have plenty already. And there's people who can survive on $400 a month and build a crappy little shack out in the woods and not have to work and just feel happy, and they just get to pay for their food and eat their food and do whatever they feel like and get buying $400 a month. Whereas if you're from a regular American family, or a higher than average American family in terms of your income, but no one's any better than anyone else. You're not any higher or lower than anyone in terms of how important your life is, generally speaking. But we also try to stand up for one another and our families more so our closest loved ones than other random people, generally speaking. But we don't want the other people to die and hurt them too much and stuff. We stand up for one another the most. So look at this face. Hey. Oh no, this is terrible. The shots and all that. It's sad when people have to go to the doctor and get too many shots and stuff. We don't want to do that. We just want to feel happy, right? So let's try to avoid the coronavirus and take precautions to not get it. And hopefully I can see my kids and play with them and stuff. I'm going to try to travel there. If I do, I'm just going to, the likelihood of getting that coronavirus in the U.S. is 1 in 300. 1 in 300 million, not 1 in 300. That'd be ridiculous if anyone was to say that. 1 in 300 million, or 1 in 30 million. It's 1 in 30 million. Odds of getting it, odds of dying from it are Well, no, actually, the odds of getting it are 1 in 300,000 or 3 million. The odds of dying from it are 1 in 10 million. And it's generally people who are like not as healthy and stuff, so probably wouldn't get it just traveling now to go see my kids, and then I'd stay somewhere where I made sure that if I did get it, they couldn't get it either, and I'd be healthy enough to fly and probably have it not affect me too much because I exercise and stuff. I'm pretty healthy. Generally, it kills people who are older than the age of 80 and who have pre-existing health conditions and stuff. So, whatever stuff is, and you can do the research on it. Wow, that looks kind of neat. Yo. There's China has that many. These are the people who have COVID-19. Can I fly or not? Yes. Here's what I titled this video. Ah! COVID-19. The facts. A concern for most? Not really. However, what is most? What is most? That is technically on the safe side. Technically on the safe side. on the safe side, I'm gonna most is more than 50% of the population. Or is it? However, don't say not really. I'm not a jerk out for myself and trying to misinform people. However, only about wait 3.4% of people infected actually die from COVID-19. And currently only 129,000 people on Earth have the virus. Cover COVID-19 currently as many people. I am a teacher to my YouTube people. Hi. I'm gonna get this statistic here a little bit so you can see it better, or this COVID-19, the facts. A concern for most. Technically, on the safe side, most is more than 50% of the population. However, only about 3.4% of people infected actually die from COVID-19, and currently only 129,000 people. Is this showing 129,000? Yeah, 129,000 people on Earth had the virus, they say. And that's in the past 4 months. But people in China may have had it before then, but they say that's just in the 4 months of exposure from the statistics shown online, which are somewhat varying from source to source, as I have noted in this video. Okay, noted. Things I learned at school. Things I learned at school. However, as my thesis reiterates, as my statement reiterates, I would like to, and that's how the English language is. That's just how you speak in the English language properly. I learned English stuff. I was good at English in high school. I liked English in high school. That's just not the most important if you are more of like a person who's like not as into academics. But in my family, we just were more into academics. So I did it too. Was more into academics. COVID-19, the facts. Concern for most technically. China has the most cases. Spam. Some jerk was using my computer. Okay, I'm gonna go. I could stay on this thing forever. Okay, I'm gonna go. I am gonna go. There's the statistics: 80,000 cases in China, 12,000 in Italy, 10,000 in Iran, 7,800 in North Korea, 2,900 in Spain, 2,200 in France, 2,100 in Germany, 1,300 in the U.S., 867 in Switzerland, Norway, 703. Wow. A lot of people died from it in the U.S. 63 people died out of 1,300. Well, that's only 63 people. 63 people out of 300 million. And it's generally those who are in not as good health or old or older than the age of 80. And it's going to help you to be in good health. But that's not that much at all. That's not that much at all compared to 300 million people. That's 63 people dead compared to 300. But this is big news. This is serious stuff. This is scary somewhat, but it's like the flu. It's like the flu, kind of. Debatably, there are less deaths from it or more deaths from it than the flu. There are various ways of looking at it. So nothing is like definitive to say that the flu is more dangerous or this is more dangerous. This just showed up, and there are far more flu symptoms than this. This just showed up, and there are not as many people with it. There's like 129,000 people with it, most of them in China. Um, the flu affects way more people. I think it affected 250,000 already just this season. And this has been around for 4 months. This COVID-19. No, yay. So you can use your own judgment and do your own research, and these are the facts that I'm offering you. I'm trying not to be biased one way or another, but take necessary precaution to not get it and to not spread it, because that'd be bad in this way if you get it. Don't infect others and stuff like that. It's a not very common thing if you consider 129,000 people have it out of 7 billion people. Let's try to do the math. Calculator. 7 billion. That's 7 million. Add 3 more zeros. Divided by 129,000. Whoops. $7 billion. Wait a second. I did the math wrong on that. Clear this. Wait a second. That's 7 million. That's 7 billion. You want to divide it by, that's people in the world. Make sure this is showing this on the channel. Yeah. 7 billion divided by 129,000. Let's just find the deaths. How many? Oh my gosh. The deaths. How'd you add this up? 4,000. Oh, 4,700 deaths, they said. 7 billion divided by 47. My son's really good at math. My son Ivan. Both of them are really good at reading and writing. I don't know how good Rowan is at math. I'd like to talk to him about it and see. He's probably good at it. I know he's really good at reading and writing because I talk to him like I send him messages every day, and he's really good at other stuff. He's really good at karate. He won a first place trophy. He's really good at karate. So is my son Ivan. They're really good at karate. 4,700 deaths out of 7 billion people in the U.S. Oh, 7 billion divided by 4,700. That's a 1 in 1,489,000 chance of dying so far right now. But you can look at the odds in so many different ways, but it's generally a 96.6 something or 97% likelihood that you'll live if you get the COVID virus. Chance of dying. Whoa, $3.4. $3.4. Chance of dying. Actually, I'm very good at what I do. I was educated at some of the best film schools. I worked at for my actual films. Actually, as you can see, I'm not even on the screen right now. I'm not trying to work it or something like some people would say, like he's showing his body, he's working it like an Instagram model who's rich. I don't want to do that. I don't care. Some of that stuff is morally wrong. Why are they showing their body? Unless they're showing the good health that they're in and they're helping others get in good health. 3.4% of dying from COVID-19. On Earth. Yeah. 129,000 cases reported of COVID-19 on Earth. What was that statistic? Oh yeah, COVID-19. That means a 1.4 million chance of dying from COVID-19. A 1 in 1.4 million chance. Typing this as I go, 1 in 1.4 million. It's not a 1.4 million chance. It means a 1 in 1.4 million chance of dying from COVID-19. However, various criteria are to be considered when figuring your exact odds of infection or death. Like region of the country or world. Region of the country or the world. What level of physical health you are at. Other pre-existing conditions. And other various factors. Okay. Whoa. Okay. Ah. Hey. Oh. Huh. Hey. COVID-19, the facts. A concern for most, technically on the safe side, most, oh, is more than 50% of the population. No. Well, no. Well, depending on how you look at no. No as not a concern. Okay. Ah. Okay. Should you travel? What is it doing? Wait a second. What is it doing? I'm gonna go. Bye.